Well, thank you for that introduction. I really appreciate it. And actually, it's a pleasure to be here with you this evening to talk to you a little bit about what I do. Just to kind of go into a little bit more detail on my background, I grew up here. This was my parents' farm, is my parents' farm in West Virginia. And we had about 50 head of cross-bred, predominantly Angus beef cattle growing up, and you can actually see them way over here on the far hill. We have hills in West Virginia, and that's some of them versus the flatland. Not really mountains. I don't really call them mountains. Some people call them mountains. I just call them hills. But I had a dream when I was in, well, really growing up, of going to vet school someday and finishing vet school. And I was going to go back here to the farm. And I was going to do predominantly large animal, probably some mixed animal work. I had kind of a practice sort of lined up. A guy that I knew back home, he was getting ready to retire, and I thought maybe I would go into practice with him, kind of take over. He did mostly small animal stuff, but I was going to kind of expand it in my mind and do some large animal stuff, and I was going to buy a truck. And I really wanted a truck, and I knew exactly kind of what kind I was going to get, and I was going to get this vet box for the back, and I was going to drive around the countryside and treat cows all day long, and it was going to be great. And then I went to vet school, and I kept that dream pretty much through the entire vet school. I knew that that's what I was going to do. And then I was in my senior year of vet school, probably about 2 months before I was set to graduate, and had a friend that we used to study together, and she told me that she was like, well, you know, they didn't match anyone. If that means anything to you. It really didn't mean anything, the word match, to me when I was a student. But they didn't match anybody for a residency in food animal and farm animal. And I was, and she said, well, you should go out there and see. I mean, it seems like it'd be a good fit for you, being at the university, kind of in a teaching capacity type thing. And I'm like, yeah, because I'm going to buy my truck, see? And then I'm going to drive around the country and treat cows all day long. And that was going to be my life, and it was going to all be good. And so I kind of blew it off for a while. Well, about a few weeks went by. I mean, we're getting really close to graduation now, and we were studying together or doing something together again, and she said, well, you should go out and talk to Dr. Hall, was my advisor at the time, the teacher, the section head of food animal. And I'm like, well, all right, maybe I'll go talk to him. So I went out and talked to him, and I said, you know, the rumor has it that you didn't match anyone for this residency program, whatever residency is, and you need someone in the clinic. And they're like, well, yeah, you're right, we didn't match anyone, but you don't really qualify for a residency since you've just graduated. You need to be out at least a year or whatever. I'm like, okay, well, that's fine. I'll see you later. And then he was like, well, but if you're really interested, maybe we can turn it into an internship program, which would be, you know, something that you could do just a year out. So I'm like, well, I don't know. And he's like, well, it'd only be a year versus a residency, which would be 3 years. I'm like, well, actually, that's perfect, because a year I can do anything for a year, right? So long story short, I got that. And I'm in that program, right, and I'm teaching students, and I'm like, wow, this is kind of fun, teaching students. And I get to work on cows, not in my truck, unfortunately, but I can work on cows all day and things, and versus having to do the small animal stuff. And so about 3/4 way through that, then I learned what a residency was, and they said, well, you know, why don't you stay in your residency, and it'll be 3 years, whatever. And so I'm like, well, I've been in school my whole entire life. If I can do anything for 3 more years, right? So I stayed and did the residency. And then about halfway through my residency, my advisors left. They all went away. And one went to Kansas, one retired, one went to Kansas. And then I'm like, huh. And then I finished my residency program, and then guess what? That opened up a faculty position here, and I'm like, oh man, this is like for life now, if I get a faculty position. And somebody said, well, you should at least apply. And I'm like, okay, I'll apply, and there's people that have way more qualifications than I do. I probably won't get it, but I'll try it anyway. And so I did, and what you know, I got it. I have to say, it's been a really fun ride. One of my biggest pieces of advice is don't close doors. Keep doors open. I cannot imagine being more set in my brain of something for sure that I was going to do, and I knew exactly to the T how things were going to play out, and it's completely different, but it's great. It's really fun. So explore your options. This is a field that, and I never thought about, when I thought about veterinary medicine, and this is one of the things too, is you guys, a piece of advice for applying to vet school is we want to see a student that knows about the profession of veterinary medicine. We don't care if you know how to treat Cushing's disease in a dog. If we can teach you how to treat Cushing's disease in a dog. We can teach you how to treat a wound in a bull, which I'm going to have a case of here in a second. We can teach you these other things of veterinary medicine, like individual pieces of science that pertain to veterinary medicine. What we want to know is on someone coming in that you have really good knowledge of the profession in general. We are hesitant to have someone come into vet school that thinks it's all about treating dogs and cats, or thinks that it's all about treating cows driving around the countryside, and then get into vet school and it's something completely different. And somehow I must have slipped under the radar, because I don't think I had that as much as I probably should have. But that's something that I guess I see from standing on admissions boards and interviewing a lot of students. We want to know that you guys have sort of this broad area, know what things are available, what can veterinarians do, right, out in the real world, and have an idea that you don't know what you want to do yet, and you're going to explore those options and keep exploring those options. And it's a career that's really limitless. And so that's one of the really exciting things I think about veterinary medicine. So just my 2 cents there. I don't know if you guys have ever heard this story or seen these YouTube videos. Every day here is different. It's crazy, and every day practice is different as well. But sorry for the blurry videos or the blurry pictures. These were they're several years old now. Back when the quality pictures weren't as high quality as what they are now. But we had 2 cows that came to the university for foot trims. And this is a pretty routine thing, right? Pretty routine thing that they come to the university for. And the reason that they come here and they just don't do it, on the farm, is because they require a bit more restraint. And we have facilities, we can restrain them. We strap them to this table, this hydraulic table, and then we tilt them over on their side so it exposes their feet, and their legs are chained down so they're not kicking us in the head when we're trying to trim their feet, which is a good thing, to not get kicked in the head. And so we got these cows. These are, anybody know what breed this is? It's the Oreo cookie cow. Yes?
Is it a belted Galloway?
You bet. It's a belted Galloway. Excellent. And so this is, there are 2 belted Galloway. I forget if they were cows or heifers. They may have just been bred heifers, like 2-year-old heifers. But anyway, regardless, they were here. They were big. They had really never been handled before. They're beasts, right? They're not mean, and I'm sure at home on the farm, the owner never had any problems with them, but he didn't work with them. And they were on the back 40 somewhere, and he noticed that, hey, they got long feet, I'm going to take them to the university. So he caught them, put them in a trailer, and hauled them an hour or whatever to get here to Ohio State. And we get them, or we try to get them off the trailer. We back the trailer up to the door, and we try to open the little slider door. They're supposed to run down the chute, and we're going to put them on the tilt table for the feed. Well, they didn't want to come off the trailer. After riding in this bouncy, loud trailer, and if you've ever ridden in the back of a stock trailer, it's not a real comfortable ride. It's not a real quiet ride. It's pretty stressful for these cows that have never been to the university before, the big city. And they didn't want to come off. They were really scared, and they didn't want to walk into our dark facility. And the driver who was bringing these cows thought, well, maybe if I go in the side door of the trailer, I'll chase them off the back end that's docked with our chute, right, to run them down the chute into the barn. And so, and I kind of missed this. I was in my office right next to where all this was happening, but my door was partially closed and I couldn't see exactly what was happening. And I hear this bang, bang, clang, and I'm like, wow, something's really going on in there. And I was about ready to get up and go out, and then all of a sudden it got quiet. I'm like, oh, they must have everything under control. And then it got too quiet. Like, this sounds like nothing's going on anymore. And so I walk out where my office was at the time. I walk out down into the hallway, and I look, and there's no one around. I'm like, that's strange. Where'd everybody go? And I look all the way down the length of the hallway, and I see one person standing down there at the very end of the garage door. And I walked down, see what was happening, and he just looked at me and said, well, they're gone now. I'm like, what do you mean they're gone now? It's like, they're gone now. They just headed right across Herrick Drive and Cannon. They're down to go in towards Cannon to the towers. And I'm like, what? It's like the heifers that you guys are having for a foot trim. They're running down the road. And I'm like, holy cow. So what, literally. So what had apparently happened is the owner or the driver opened the side door of the trailer, and although they didn't want to go in the barn, they thought the parking lot, the nice bright parking lot, looked like freedom, and that was a good place to go. And so they jumped out there, and before we could close the gates to the parking lot, they kind of ran around and then ran the back way out, and they were headed down. This is the soccer field. That's me right there in scrubs. I learned a few things that day. One, this was like a nice warm day in May, one of the first kind of spring days that we had. It was getting hot running back and forth from school over to the soccer fields and back. I learned I was out of shape that day. I also learned that these soccer nets really don't do a good job corralling cows. I had the idea that maybe we could move these soccer nets around and force them against this fence and they would be trapped in the soccer net. But I guess they kind of see through this net too well, and they just didn't respect it, and they just kind of ran through it and around it. And so I'm like, that didn't work well. And the OSU, I don't know how expensive these things are. I imagine they're pretty expensive college-level soccer nets, but they probably didn't appreciate me using that as a thing, but they were there, seemed convenient. But this is fun. I also learned that police cruisers, there's a reason that cowboys don't drive police cruisers around. They're not really that agile. I don't know if I don't have a picture of that. They're not really agile enough to kind of corral cows, and they were trying to corral them on the soccer field. I apparently don't have a picture of it, and drive them towards the fence. And we actually at one point in time had a trailer over there, and we're trying to herd them into the trailer, and that worked very poorly. But anyway, we eventually got them. What they did do, what the heck is that? How did that pop up? That's weird. That's a PowerPoint. I don't know how that popped up. Anyway, so strange. Technology these days. It's got smart and it pops a message up. It's weird. Anyway, so they did bust up these cows, right? And so one of them stayed on the soccer field, and this other one ran back Herrick Drive, down across Cannon, which is a busy road, and ran down Herrick Drive and then over to where old Vivian Hall was. It's torn down now. and caused fiasco. We eventually got both of them. We ended up darting one of them and got them in there. Despite what you may read in the papers and in the news, somewhere something got wrong. Neither one of these cows died. They were shot at. By the police, but they didn't die. We took a bullet out of one, actually two, I think. So it came in. So believe it or not, they came back in a week later, and one had an abscess. The one that got shot like 7 times. They just kind of jumped around. I don't know what they were shooting with. They just kind of jumped around like, oh, that hurts. But they got fun. And we took out at least, I think, 2 or 3 bullets. And then we put them in one of our sample jars, and we called the police and said, hey, we've got these. Do you want them for, I don't know, ballistics or something? What do you do? I mean, on CSI, they probably want them. And so they didn't come and get them. And they're like, we only took 3 and out. And I'm like, yeah, that's all we found in there. And it's like, well, what happened to the other 4 or whatever? Like, we don't know. They weren't in the cow. They might be in the side of a building or something like that. But anyway, but we ended up darting it and then sedating it enough that we went and caught it and then pulled it onto a trailer. So that's exciting, you know. Things like that don't happen every day. I got a call last week. This was about, I don't know, 5-10 years ago now, somewhere like that. But I got a call last week from a rescue down in, I think it's actually a rescue in Georgia, but based on the voice. But anyway, they said that they found this farm that was a hoarding operation in Kentucky, and they rescued all these pigs, and they rescued 500 pigs, and they need to get them spayed and castrated. And I'm like, I listened, this was a voicemail message that I got, and I'm like, did they say 500? And this is crazy. 500, maybe they said 15. And like I said, and there was a bad connection, and the 15 turned 500. I don't know. And so I called them back, and I'm like, did you say 500? And they're like, yeah, 500 pigs. I'm like, holy cow, again, and holy pig. And I'm like, and they're like, how many can you handle at one time? I'm like, not 500, maybe 20 that we can see in the hospital. I'm like, okay, we'll start in small groups, and we'll start there. And so I said, well, let's bring in the males first, because the castrations are going to be easier than the female. And they said, oh, it's a 50-50 split, so like 250 spays. This is going to be incredible. But anyway, let's start with 20 castrations, and we'll see how many we can rock through, get a handle on the whole situation. So they actually dropped off yesterday. They only brought 13. I said you could bring 20. They only brought 13. And so today, this is what we did in the OR. Let's see if I can turn the lights down so you can see it better. Let's our bright projection, moderate projection, dim projection. But it's dim. It might get to. Okay. So this is our OR today. This is room A. This is our main surgery suite. And we did 4 pigs at a time, which is kind of cool. So there's 1 pig there. There's 2 pigs on this table. They're both facing each other right in the middle. So we've got one group of students over here castrating. We've got another group of students over here castrating. And then we got this pig back here. This pig back here stopped breathing for a while. And so we got it intubated. We actually just did these under injectable anesthesia. And we didn't have a tube in their trachea, and they were breathing fine. They did great. But this one decided that he didn't want to breathe, and breathing was an optional thing when he was sleeping. And so we ended up putting a tube in his trachea, and that's why all these people are here, because they're breathing for him. But he did good. He started breathing about halfway through the procedure, so that's on his own. I mean, we started breathing for him. When we noticed that he wasn't breathing, we're like, you need to breathe. We're going to breathe for you. And so we did for about 10, 15 minutes. And then he's like, okay, I'll start breathing again. Maybe it's 2 minutes. So we got 13 done between noon and 5 o'clock. So I think that's pretty good. We could probably do, I think if we started early and we didn't have any other cases, we could probably do 20 in a day. I don't know how many spays we could use. These are all castrations. Anyway. So again, you never know what you're gonna run into. This was a bull that we saw probably 2-3 months ago. And the history on this is that it's a crossbred bull that was on pasture, and the owner says that he got his neck stuck in like a bale feeder, a round bale feeder, a few weeks prior to when he came in. And he, the day before he came in, they found kind of a scab on his neck, and it looked big, it looked kind of ugly, and so he decided to bring it into us, and we're like, okay, yeah, let's take a look at it. And wounds can be actually kind of fun. Wound management is kind of a fun thing, I think, to deal with. And so we pulled the scab off, and that's what we found in the wound. What do you think? You guys know what those are? Maggots. Oh, yeah. Lots of maggots. So I was actually putting this presentation together a couple weeks ago, and I actually presented it to the Food Animal Club, which is an organization that you can get involved in when you are in vet school. And some actually undergrads can, some of you guys may be involved in. Anybody come to any Food Animal Club meetings? So a few of you. Anybody at the meeting where I presented this? Yeah, so you've seen this before. But anyway, I was putting this presentation together for that meeting. And my wife, who's a small animal vet, she was looking at, like, over my shoulders and watching us put these pictures in. And she's like, oh man, that's gross. She's like, you're not going to show that, are you? And I'm like, yeah, people are going to think this is really cool. This is a really cool thing. So I want to take a poll right now so I can, like, tell her that I was right. How many people think this is cool? Oh yeah. Anybody think it's gross? Anybody going to admit it with that many people? Oh, okay, we got.
I'm gonna go with both.
You're gonna go with both. Cool and gross. All right, I can take that. So these are maggots in there, and what is really cool, if you thought that was cool, watch this. So they're all wiggling around in there, and I got a couple views and sort of melded them together. So yeah, lots of maggots. So let me ask you guys a question, and I asked the vet students this too when I did this Food Animal Club meeting. What do you think the likely outcome? Do you think this is a good? You have this, and just for a frame of reference, if you couldn't tell by the size of a maggot. You've ever seen a maggot before, and how many were there, and what the wound size is. I mean, this wound was about that big, around like a dinner plate type of thing. And so, do you think this is a pretty good prognosis? Would you say it's excellent to good? Would you say fair, like you got a 50-50 chance that this is going to resolve? Guarded, meaning it could go really any way, but it's probably not going to end well. Or grave, meaning it's definitely 100% not going to end well. So what do you think? Good. Good? Good. Yeah. Okay, good to fair. I mean, you can never go wrong with 50-50, right? I mean, 50-50 is, I always feel like 50-50 is a cop-out, in that, it's like, okay, come on, 50-50, but I give it all the time, and usually owners don't question me too much on it, like, that's 50-50. And then if it goes good, it's like, yeah, well, I said it was 50-50, you have an equal chance of getting good or bad, or good bad, and it's like, it's only 50-50. So yeah, I'd say it's good. Actually, knowing about wounds. And one of the things that determines whether wounds are going to heal well is whether they are, or what part of the body they're on. Wounds that are on the neck, the outside of the chest, the skin of the chest and the back, those usually end up doing pretty well. Wounds that are on the legs don't usually do very well. And the reason, the determining factor, is how much extra skin is around the wound that the wound can actually kind of pull over itself to cover it up. And if you know anything about wound healing, again, I think wound healing is kind of cool. If you know anything about wound healing, what happens is that you get this bed of what we call granulation tissue that forms underneath the wound. So the scab comes off, and actually, before the scab comes off, in the natural process of things, while the scab is on top of it, you've got what we call granulation tissue that starts forming under the wound. And this is new tissue, it's got a good blood supply, and it starts filling up that wound defect. And if you wait long enough and you pull that scab off, you can have this big deep pit at first, but then this granulation tissue will fill up this wound. Well, if there's not extra tissue around, loose tissue, if you can't take your skin and do this and pinch it and wiggle it around the wound, what ends up happening is after that granulation tissue fills that wound up, then the only thing left to put over that granulation tissue is basically scar tissue, and it forms a big scar. Or it doesn't heal at all. Or what ends up happening is the granulation tissue doesn't stop forming, and then you get proliferative granulation tissue. We call that proud flesh, if you've ever heard of that. But if there is loose skin around it, and this is an amazing thing, if there's loose skin around it, what ends up happening is the granulation tissue and the little cells basically in the granulation tissue sort of grab one side of the wound, and it grabs the other side of the wound, and it pulls it across. And it starts what we call a process called contraction. And it's amazing. And so the granulation tissue fills up the wound, and then so you got this nice pink granulation bed, you got normal skin around, you got this nice pink granulation bed, and then all of a sudden that wound starts shrinking in size. And it starts going down as the skin around it starts pulling down. But that requires loose skin, enough extra skin around it, because you're not going to reform skin. Okay? You don't reform skin. You can mobilize the skin that's there, and if you can't, then it's going to form another tissue, but it's not going to be normal skin. It's going to be scar tissue. So it pulls the wound down as much as it can, and it stretches the normal skin around it as much as it can down, and then as soon as that skin, basically the tightness of that skin equals the strength of those fibroblasts that are trying to pull this wound across, as soon as those forces equal each other, then what ends up happening is then you get this white kind of scar tissue that covers the rest of it, and it's not normal skin. And so, but this is a good place for this wound to be, up on the neck area, and so I was pretty optimistic about this. And so, what do you think, what should we do now? So these are options. If you have to choose one of them, what would you do? Would you just put some fly spray on it and send it home? Would you dump some sugar on it? Would you debride it and clean the wound, maybe flush the maggots? Debride means cut away dead tissue, kind of wash the maggots off there. Would you put some topical antibiotics like Neosporin or something on it? Give it some systemic antibiotics, like give it an injection of something, like penicillin or something like that. Would you try to surgically close the wound down? Would you kill the bull, euthanize it? Or do absolutely nothing, which I guess do nothing is, so well, yeah, do nothing and send it. What do you think? Any thoughts? Flush the maggots out? Okay, good. I like that. You want to do anything? I said to pick one, so you did that. Good. Does anybody want to do something else, or do you want to do something else in addition to flush the maggots after flush the maggots?
Antibiotics after you flush it.
Antibiotics? Okay. Do you want to do topical antibiotics, or do you want to do systemic antibiotics?
Systemic.
Systemic? Okay, good. Any ideas why you want to do systemic versus topical, or?
Covering all your ground.
What's that?
Covering all your ground for infection.
Okay, so if it's not just localized there and it's more deep into the tissues, it covers your ground. Good. Yeah. Okay. I think that's very legitimate. You guys want to do anything else? What's that?
Fly spray.
Fly spray. Good. Yeah. So there's a lot of good options here. Definitely fly spray. I think to kind of to kill these. Anybody else? What did you say? Sugar. You want to do sugar? I love sugar. All right. So sugar is actually really good. I wanted to talk about sugar. All right. So can you think of anything that sugar would do for a wound? Soak up the moisture. Good. And so it's hypertonic, meaning it will suck moisture into if you put a lot of sugar in, it will suck moisture into that. And it also, in the process of doing that, it promotes actually blood to come into the wound. And it also, believe it or not, sugar in high concentrations doesn't allow bacteria to grow. It's a preservative type thing. And it's like in your jar of jelly and jam. It's got so much sugar in it, bacteria probably is not going to grow very well. Now, other things like molds and funguses and stuff sometimes will grow in it. But the reason they grow so well in it is because bacteria doesn't grow, and you don't have the competing bacteria and other organisms in there, right? And you can actually get really, really high concentrations of sugar, even more concentrated than in your jelly. It's actually really most all organisms won't grow in there. So it actually can be a really good environment to kind of kill organisms and things that are in there. It's really good for wounds in this stage. And it does what we call a good thing with debridement. And actually a lot of these, with the exception of euthanize the animal, and I would say close the wound, I'm glad that we said that, are probably good things to do. You could argue back and forth between topical and systemic antibiotics. I think your rationale for systemic antibiotics are a good one. Honestly, I probably would do both in this case. If I was